So we're going to talk a little bit about all of those and how telehealth impacts and assists in reducing some of the expenses in those areas. So as we know, obviously, telehealth can impact the expenses of the patient. Often that's the last group of people that are really considered in this whole equation, where at least in my opinion, they should really be some of the first, because ultimately they pay our paychecks. They are the ones that are responsible for making sure that we are all here. And so helping them in their expenses and in their time when every family is looking at their bottom line and their pocketbook, I think we need to be really cognizant of the patient and their needs. And so how do we help them in their reducing time, not only away from work, but that travel? I mean, telehealth can really help those families in those areas. Also helping them manage their healthcare dollars better. As a patient maybe can't get to the large urban center where their specialty physician is maybe living, they can see that physician via video or via telemedicine and other technologies. And that in turn can help them either get to their physician on a regular basis because they can afford to, or simply get there at all. Sometimes that's the only telemedicine is the only way that they are able to get to see their physician, because they just can't get there in another manner. Providers are also looking at telemedicine as telehealth as a way to reduce their expenses. From the perspective of the specialty provider, maybe they're looking at ways, they have outreach services, but as we all know, providers are also looking at their bottom line, and often outreach opportunities are some of the things that they look at first to cut back on, to figure out how to reduce their expenses. And so this is really an opportunity for them to look at, to figure out how to maintain an outreach service and improve their referral reach. Of course, it's, the dollars are important, and I think that's the piece that we really need to kind of keep in mind. The primary care provider is also a beneficiary, though, of telehealth services. It helps them to maintain the control of that patient's care. It involves them in that communication more regularly with that specialty provider and with that patient. And they don't tend to lose that patient to referral. That does happen. You don't like to raise that up issue too high, but occasionally, right now, without telehealth, sometimes even with telehealth, but not as frequently. I think that's the piece that is really critical. Of course, the facility also is benefiting from telehealth as well. They are able to provide, this would be the referring facility. They're able to provide and charge for some ancillary services that they may not have had the opportunity to be involved with previously. Some lab tests that are done as a result of the telemedicine consult, some x-rays that are maybe performed. Those are some of the things that they benefit from. And we've actually had a facility that has tracked those charges over the course of, I think they did an 11-month study. I know it's kind of an odd time frame, but they did an 11-month study, and they generated, and this was 2 or 3 years ago, and they generated about $24,000 in charges for their ancillary services that they performed as a result of the telemedicine consults. At that point, they were only doing, oh golly, maybe 10 consults a month or something on that. They're now up to, I think, up to 35 consults a month. So you can see where that then starts to really generate some real dollars for them. The facility also can then be perceived as really a total health care facility. Some of these rural sites are really building up what they deliver as part of their services in their rural community. They're not just a hospital, they're not just the ER you go to. They're now the health care facility. You go to see your specialty physician, you go there for your ancillary services, your other services along the way. It also improves that perception of quality care being provided at that local facility with the specialty services and the wide range of services that are now available as a result of the telehealth service availability. And then from the system as a whole, more efficient use of your staff time and provider time. You can really help your facilities across your entire system adhere to the standards of care. You're looking at cost savings for appropriate transports now, as well as maybe utilizing telehealth as being a market advantage for you as a health system. So as we talk about access, that's kind of the next issue that we're all dealing with. And we've had a great push and great need to really improve the ability to access quality care services, no matter where you choose to live. So those are some of the areas in which access is really being looked at and evaluated. From the clinical care, we all know that there's just simply not enough specialists to go around. These people are not getting through school quick enough for us all. We saw the baby boomers. I mean, we're kind of and I'm on the tail end of that list, but I'm still a baby boomer. And we are going to be growing and growing into that need for those healthcare services. And we don't have enough specialists to go around for us all. Tele-ICU is another area in the clinical care area that has really seen a lot of growth and interest, where you're able to remotely monitor on a 24-hour basis ICU patients in smaller facilities. I know within our health system, we were the first health system to really utilize the tele-ICU service in very rural areas where they're serving maybe one ICU bed, 2 ICU beds. Disease management is another area of access that telehealth can really assist with. More pressure, there's more pressure out there to better manage those chronic diseases, whether it's diabetes or CHF, or allergy, even HIV/AIDS. That there's increasing pressure to make sure that those patients are really not becoming our frequent flyers, or at least reducing their time in the ERs. And then home health is another area where access is really critical. There continues to be an interest in aging in place. As I get further into that bubble, I too will want to spend as much time as I can in my own home, as opposed to needing to go receive services elsewhere. My parents are in that boat now, and they want to stay at home as long as they possibly can. And I believe that telehealth services in the area of home health will really help impact that, as well as improving the disease management from the home perspective. So now as we look at services, how do we maintain and grow clinical services? And I believe that telehealth is really another opportunity to grow into those areas as well. So as we look at support, many services, what are the services that you as an organization are raising up as your key services? We visited with the folks with the Colorado Neurological Institute last night. Now, obviously, stroke is their interest. So those are raising up those services that is your bread and butter, and how can telehealth can really help you do that. What brings in your business? How do you keep providing the services that you already have? How do you reduce the need to reduce services, to cut services? I think that telehealth can really help in those areas. For example, our sites or our physicians doing on-site specialty outreach. We've had situations where we've had a specialist that said, I just really can't go there every month now. I don't have the volume, I don't have the budget to support that. So we've talked with them. It's like, okay, if you can't go there every month, can you still go there maybe every other month, and then enhance that service by providing telehealth connections on that month that you're not there physically. Meeting the standards is another area where telehealth, I think, can really be of assistance to us all. As we're looking at telepharmacy, how do we provide that 24-hour pharmacy oversight? I think that telepharmacy is an excellent opportunity to assist with that area. Supporting your ER without violating EMTALA, obviously, that's critical. The ER is, I think, an area where, from the perspective of telemedicine, telehealth services, is something that has been on our radar since the beginning. How in the world, can we get those services into the ER?